kind of treatment. When the person is erosive and he can maybe cause some damage around, or maybe it's not unstable to be talked to, they administer some medication called anticonvulsants. So once you see that now the person has stabilized, then you change the kind of treatment. In the process, somebody is continuing to be talked to by the counselor who is specifically assigned to that person.
So you adjust the treatment according to the stages
yes,
of recovery.
Yes, so the patient now goes on recovering. Then you adjust. Eventually you do away with the treatment, and then it becomes now an issue of psychosocial support.
Okay.
That's why you find that now from the treatment, once somebody has stabilized, then we take that person, that particular patient, to a rehab, whereby now there's a different environment, which is not for medication. It's not a medical environment. It's just an environment where now he socializes with others, and then we have therapy. They have classes also there. They have at times to go for games. They are taught of how to make, to be orderly and to be decent.
Okay.
Then from there now the evaluation also continues. We have the evaluators who come and evaluate, specifically during the times of visitation. We evaluate. Even we go as far as now knowing who is now stable and who can now be discharged from the rehab center.
So the withdrawal of medication has to come from the psychiatrist.
Yeah, from the psychiatrist.
What about patients who try to wean themselves off the medication in the hope that is going to speed up their recovery?
At times it is not recommended for a person himself to try to wean himself or herself from the treatment, because they might administer something that can be a drink again. So it's better to make it a professional way.
Okay.
So a professional way is that a psychiatrist can come in, and then from there now they can recommend which kind of, because during the medication, the psychiatrists know what kind of medication comes first. So because it goes in levels, so that from there they graduate to another level of treatment. From there they graduate, and then from there now they start now decreasing the kind of dosage. Then from there you find that now if somebody has now been stabilized, then eventually now say, okay, this person is stable, he can go for counseling, where he can sit with a counselor or a therapist, and then they can talk and they share. Then from there, the improvement, even the sessions are assigned to that particular person.
Okay.
And after a particular number of sessions, there's an evaluation done to the particular person. And then there is record keeping. You find that as you look at the records, you see where the person began and where it has reached. And now we can now predict where we are heading to.
Absolutely.
Yes. And then from there, after the rehab, you cannot just drop somebody outside to the community like that.
Yes.
We do follow-ups. Follow-ups must be done to that particular person. Proper counsel also, and proper monitoring and supervision must be done to that person to a particular point whereby you see now the person has now resumed normal and can now perform.
All right.
Yes.
And I'd like to hear from you, James, looking at